So here we're continuing on our central nervous system infections, and we're going to talk about parasite and fungal infections of the central nervous system. So fungal infections of the central nervous system are going to be an indication that there is something else going on with your patient, because most immune competent individuals are going to be able to clear fungal infections before they have a chance to get to the central nervous system. So fungal infections should be considered opportunistic when they're in the central nervous system. So these are going to be found primarily in immune-compromised patients. Cryptococcus is the most important fungal CNS infection, and this is going to be caused by Cryptococcus neoformans. This is going to be an encapsulated yeast, and you can see these capsules, these little bubbles or halos surrounding the actual yeast, which is in the center. The capsule is going to be part of the yeast life cycle, and you're going to be exposed to this from the environment. This fungal agent is found worldwide and is going to be especially found in soil with bird dropping contaminations. Birds are going to take in the fungus, but they do not get sick from it, and they simply excrete it. And again, a healthy individual will come in contact with Cryptococcus neoformans and be able to eliminate it just fine. Now, crypto is going to cause an infection, which is going to be a slow, insidious onset. The symptoms are going to be a low-grade fever, headache, and it's going to eventually alter the mental status of the individual and form seizures. Now, Cryptococcus is usually going to start as a lung infection, but in an immune-compromised patient, it's going to be diagnosed as a central nervous system during its central nervous system stage. So infection is going to be in immune-compromised patients, such as AIDS patients. And the infection is, again, going to start in the lungs. And you're going to inhale the yeast cells. And then the yeast cells are going to have its capsule. And so the yeast cells are going to be able to evade the immune responses to some extent, but an immune competent person will eventually be able to clear it due to their T cell response. An immune-compromised individual that is unable to mount a very strong T cell response will have problems clearing this fungal agent. Now, once you get your not spores, but your encapsulated yeast are going to be taken up through your lungs, you're going to get expansion in your lungs of the yeast. And then the yeast is going to spread through the blood, fungemia, and then it's going to be able to cross the blood-brain barrier, and then you're going to get infection in the central nervous system. Now, the symptoms can continue for weeks or months. You can get intermittent headaches, dizziness, and then you're going to have seizures and dementia slowly develop at the later stages of infection. In patients with AIDS, this progression is going to be accelerated. Okay, so now we're moving into our parasitic infections of the central nervous system. And so we have our primary amoebic meningococcal encephalitis, and acanthamoeba is going to be a cause of this. Naegleria is also another cause. So these are free-living amoebas, and they can cause a fatal infection, but they're also very rare. Now they have a cyst stage, a trophozoite stage, and they also have a flagella stage. And so they're going to be found in water, so recreational water, warm water, ponds, those type of things, and they're going to find their way into the respiratory tract, the nasal tract, and then from there they can burrow into the central nervous system and cause an infection of the brain. Acanthamoeba likes to have soil and fresh brackish water. It's going to be most often in the southeast of the United States. And then patients are going to feel ill after swimming, and then it's going to progress very rapidly. Naegleria is another amoeba, and this is going to enter the central nervous system again through the nasal mucosa. And this one is going to burrow its way through the cribriform plate. It's going to produce a hemorrhagic inflammatory reaction, which is going to be purulent or pus forming. Your immune system is going to try to move in and clear this infection. It has trouble with the larger amoebas, obviously. So you have a bifrontal headache and seizures, which progresses to coma and death within days. So it's very hard to treat. It's usually diagnosed post-mortem. You can take mounts of the cerebrospinal fluid and you can find your trophozoites in your cerebrospinal fluid, which is going to be the active form of this parasite. The amoebic meningoencephalitis, again, is going to be a diffuse necrotizing, so areas of necrosis of the brain. You can find cysts and trophozoites in the lesions of the brains. The amoebas are going to be, again, in the cerebrospinal fluid, so you can take cerebrospinal fluid for diagnosis. You can also have ulcers and nodules forming in patients with AIDS who have limited immune capabilities to control this infection. Now, acanthamoeba is going to have a more prolonged disease course than Naegleria. Acanthamoeba also sometimes ends with spontaneous recovery. Naegleria is the more faster and progressive disease that usually results in death.